I'm going to talk to you about inner northwest London predominantly, because that's where we've started our pilot, and our cohort consists of 550,000 patients. What have we done? We've got shared data in a single IT platform. We've got all of our providers to collaborate and communicate. We've got primary care, community care providers, social care providers, mental health trusts, and acute care trusts, including Imperial, working together. So what's the big idea? The big idea is along two pathways, focused on a disease-specific pathway for diabetes and one for elderly care. We're trying to achieve collaboration and communication with shared clinical practice across all of the providers, and we have over 100 GP practices now in our pilot. 2 acute trusts, 5 social care providers, 3 community providers. Our aim is, over the 5-year duration, to reduce non-elective activity by 30% in our disease groups, reducing the cost by 24%. The 7 elements. Essentially, you need a patient registry. That's fairly easy for us. We've got that in our IT tool. We know who our diabetics are, and we know who our over 75-year-olds are. In fact, we've identified diabetics who didn't know they were diabetics. We apply risk stratification algorithms. We are using the CPM model for elderly care, and we've devised one for diabetes. We conduct proactive care planning using an agreed shared clinical protocol that we've developed at the MDG level. So the patient's called in for an enhanced GP review appointment for 45 minutes to find out any unmet needs using standard templates. Now, a certain segment of these patients are deemed as extra complex and are therefore discussed at case conferences. And we approximately have 1 case conference per month involving specialists as well as the cohort of GPs and community providers and social care workers, as well as a mental health specialist. And finally, on a quarterly basis, we evaluate our performance, practice to practice, and also MDG group to MDG group across the aims of the pilot. The Icp It Support Tool, it essentially does risk stratification, allows you to do care planning on the tool, which then can send notices and notifications to the providers in the tool. We share that medical information, including medications, for example, and key metrics such as HbA1c, cholesterol, blood pressures, and we can use the tool to do performance evaluation and produce dashboards for ourselves and for our providers. So what's the cost of running this pilot? Well, continuation of the pilot for the year, and we've just had our business case approved, is another £3.5 million for running it. The extension of evaluation and research is another £300,000. We're looking for any funding, so if anybody wants to fund that, please let me know afterwards. We need a further £500,000 for education and organisational development. We're going to take on 2 new pathways, we're hoping, CHD and COPD. And finally, we're expanding geographically to involve the whole of Hounslow and Queen's Park, which is just north of Westminster. And finally, I'll leave you with who the partners are and who's been involved in the project. As you can see, we've had numerous organisations involved to get to where we are today. Thank you for listening.
Thank you. Thank you very much. In terms of measuring your success, for example, the outcomes framework talks about the quality of life for patients with long-term conditions. How are you measuring your success? Are you doing it in relation to quality of life measurement?
I don't think we're taking that exact metric, but we are. Our metrics mainly focus on patient outcomes, so they do focus on that. They focus on patient experience. They focus on the non-elective activity, the clinical metrics. We've held the patient evaluation slightly at arm's length from us, but we should, moving forward, we're building in patient experience scores on the new IT tool and looking at the evaluation.
From the Dragon Den point of view, you were talking about the investment you required for further development. Why isn't that investment being generated within your system from the savings that are being realised?
We had a really complicated meeting on finance and performance, and and somebody keeps moving the goalposts for what we need to achieve. So when we looked at 10-11 activity, and if you look at 10-11 as our baseline, we're almost achieving the savings we require to run. However, the 11-12 baseline has been reset because of what we've achieved and because of what commissioners have decided that acutes are going to now get. So our goalposts have now moved, and our achievements are now, the pot of money that we had has suddenly moved. Does that answer the question? That's the complexity we have to deal with.
Seen from a provider's point of view, yes, it does. And I'm not sure it sees it from the Commissioner's point of view. So to that extent, there's a kind of...
We're in dialogue with the Commissioners. The Commissioners
led?
are kind of seeing our point of view, which is really encouraging.
And as with Torbay, we don't have any money to spend. So what would you like of us to help you take forward the work?
So I think that if I had an ideal system, I would, at the moment, we're developing the second phase of the IT tool, for example, for data sharing. And we're doing that in Northwest London, and I'm involved at quite a high level on that. But then I realised North Central London are doing the same thing, East London doing the same thing, South West London are doing their own project, South East London are doing their own project. And we're all spending significant sums of money on various integration projects for data. And nobody seems to be collaborating or getting that together and actually saving and realising costs involved in that. So we're going to have separate and disparate systems in each of the sectors, which is integrating data. Now that may work for each of the sectors, but I think that if you live on the boundaries of two of those geographical areas, it's going to be a bit of a nightmare for you.
So, being in the middle of all of that, who do you think should be getting a grip of that and providing more connection than there seems to be at the moment?
So, I mean, I'd like to get a grip of it personally, but I'd need some funding. I need some support. I think that clinicians, IT-led clinicians, certainly do understand what's going on in each of their sectors, and we've even talked. We were involved in the My Health London project, some of us, and we talked at that project saying, look, we're all in one room together, but we're working on a project that really we don't really want to be working on that much, but we're working on it anyway. Wouldn't it be great if we were working on a project that truly would deliver greater patient benefits?
Okay.